Hello, do you need help choosing a Medicare Supplement plan letter? Stay tuned. Hello, this is Billy Williams, Medicare Health Insurance Options. Our phone number is 800-499-1942. In this video, we're going to talk about choosing a Medicare Supplement plan letter. The first thing we're going to do is just take a really quick look at a chart that shows all of the different plan letters, and you can see there are very many to choose from. As you can see from the chart, if you have Medicare Part A and B as your main coverage and you wish to get a secondary plan, more commonly referred to as a Medicare Supplement plan, the choices that you have officially are Plan A, Plan B, Plan C, Plan D, Plan F, High Deductible, Plan F, Plan G, Plan K, Plan L, Plan M, and Plan N. So this seems sort of overwhelming. They're all similar, but they're all different. So which one would you possibly choose? Fortunately, it's really not that complicated. Very rarely do we ever recommend or sell any plan other than Plan F, Plan G, or Plan N. So those are really the only three that we're going to discuss. The other plans are plans that we don't recommend that you're not going to ever have to consider. So let's just quickly go through the plans that we do recommend to our customers. The first thing to mention is that the Plan F, the Plan G, and the Plan N all work exactly the same if you are covered under Part A of Medicare. Part A of Medicare covers you if you're in the hospital, in a skilled nursing facility, or hospice care, rehab center, some facility like that. If you are admitted to the hospital, it doesn't matter if you have Plan F, Plan G, or Plan N. You can see by this chart that your Part A deductible is covered 100%. And you will not have any additional out-of-pocket. We have a Plan F, which is a very popular plan for many years. The Plan F is popular because it's very easy to understand how the Plan F works. The overall healthcare costs every month are very predictable. So if you have a Medicare Supplement Plan F, your Part A and your Part B of Medicare are your main coverage. And then the Plan F will step in as your secondary to cover your Part A deductible, your Part B deductible, and any co-payments. So between Medicare and a Plan F working together, all of your doctor and hospital bills will be covered 100%. That is the reason why the Plan F has been very popular for many years. Unfortunately, because the Plan F does pay for everything, it does become the most expensive and also gets the most rate increases. So there are a couple of other good options. Next, let's talk about Plan G and Plan N. We're going to see with this next chart that Plan G and Plan N do have one thing in common other than paying for your Part A deductible, is that on Plan G and on Plan N, you are going to be responsible for your Part B deductible. As of the making of this video in the year 2018, the Part B deductible is $183. That figure can change in the future. However, presently, if you have a Plan G or a Plan N, you are responsible for the first $183 of medical care you receive every year that is not covered under Part A of Medicare. So for most people on Medicare, the majority of the medical care that you receive each year will be covered under Part B of Medicare. So each calendar year, Starting in January, the first $183 of medical care you receive. If you have a Plan G or a Plan N, you are going to be responsible for that amount of money. Plan G and Plan N are different. On the Plan G, once your Part B deductible is covered, you will not have any other out-of-pocket expenses for your doctor hospital bills. If you have a Plan N, after your Part B deductible is covered, there are two other situations where you might have a small out-of-pocket expense. The first is if you go to a doctor and your doctor files a claim to Medicare, and part of that claim includes a doctor office visit fee. You are going to pay 20% of the doctor office fee on a sliding scale, but with a maximum of $20. It's kind of like a copayment. Technically, it's not a copayment because it's not a flat fee, but it is a maximum of $20. So most people who have a Plan N, once their Part B deductible is satisfied and they go see their doctor, they're going to get a bill in the mail. They're going to have to pay the doctor somewhere between $15 to $20. The other scenario on a Plan N where you will have a small possible out-of-pocket expense is a visit to a hospital emergency room where you are not admitted to the hospital. In that scenario, you do have a cost-sharing payment with a maximum of $50. It could be less than $50 depending on the amount of the emergency room bill, but you will have a maximum of $50. So let's review. Medicare Supplement Plan F is the most inclusive coverage that pays the most benefits, but is also always the most expensive. Plan G is also a very good alternative. We have many of our customers on a Plan G. It is still very good coverage. The only difference is you have a small annual Part B deductible that you have to meet. In many cases, the monthly savings between a Plan F and a Plan G is enough of a savings to make it a much better value. If you can save 20 or 30 or more dollars per month by moving to a Plan G, the amount of money you save throughout the year can be considerably more than the Part B deductible. In this case, it is a better value to you. The Plan N is also a good coverage and is the least expensive of the plans that we recommend. We recommend the Plan N for people that are relatively healthy, do not have a lot of doctor visits throughout the year. When looking at the Plan N, in many cases, the price savings each month in premium is enough to make it a better value simply because if you don't have a lot of doctor visits, you're not going to have a lot of co-payments, and you will be able to save money if you look at your total out-of-pocket expenses. So we have a lot of companies that we represent. We are an independent agency. We would be very happy to talk to you. Our services are always free. We can look at your location, your age. We can look at the different companies offering the different plans in your area. We can give you some pricing and some recommendations. And if you have any questions regarding which plan letter to choose, please give us a call at your convenience. Thank you for watching our video. Once again, my name is Billy Williams. You can call me at 800-499-1942. Visit our website at MedicareHealthInsuranceOptions.com. Please subscribe to our channel and share and like our video.